I just was delighted to be invited to say a few words of support for this conference at the outset of the gathering, and bringing together all of these important issues today, because I do very much strongly support the idea of having a focus on women's rights in healthcare. And it's justified in having a distinct focus on physiological grounds, obviously, but also on women's different economic status, which we know impacts on health, and women's different role in caring for health within the family, and women's different role in the provision of healthcare services. So for all those reasons, it's right that you have this annual conference and you have this focus. And I think my starting point would be, is that women's voices have to be listened to. But you can't get health policy right, you can't get healthcare right, you can't get the delivery of health right and health equality achieved if you don't have women's voices listened to. But it's not just enough to say women want to be heard. I think that always ought to be coupled with that women have got to take part in decision making. We don't want to be, as women, heard by a male room, and then the decision is made by the men in the room. We have to have women's voices heard, but also women must have an equal share in decision making. We've got a new chief executive of the NHS, Amanda Pritchard, so we've got a woman at the top, and I hope that she will ensure that decision making is equally made by men and women at all levels of the NHS. And of course, women's role in providing healthcare services is incredibly important at all levels. But for women's voices to be heard and for policy to be right on women's health, there must be a critical mass of women. It can't just be one woman here or there. There has to be a critical mass to enable the agenda to include women's health issues. I remember when I was first an MP, I first became an MP in 1982, and I did an audit of the government advisory committees for different government departments. These are the committees which are appointed by government to advise government departments in the delivery of their functions. And one thing that stuck, and I looked at how many men and how many women were on all these government advisory committees, because we had a parliament which was 97% men. It was reported by a 97% men press gallery to the public, and therefore government was very male dominated. But I wanted to look to see whether the advisory committees included some women on advisory committees, and of course the picture was the same. The government advisory committees were male dominated as well, but the one that really struck me and still sticks in my mind is that the Maternity Services Advisory Committee had no women on it. And that was the thought in those days. You needed the experts, and what would women have to contribute to a Maternity Services Advisory Committee? Fortunately, a lot of that has changed over the years. I remember when Dawn Primorono in the early 1990s, as a member of Parliament and a minister in the Treasury, raised the issue of VAT on sanitary products in the House of Commons. And literally, the men in the House of Commons not only could not speak in that debate, they just did not feel able to say the words, but they just didn't know where to look. And it was the first time on the floor of the House of Commons I'd actually seen men simply not able to speak in a debate. But now that has so much changed, with women of all ages in the House of Commons and on all sides of the House of Commons. So, for example, we are able to discuss issues around menstruation, particularly issues of period poverty and the need to address that. And the same has been done in the Scottish Parliament. The menopause is actually discussed. You know, I thought I would be, you know, long retired before the House of Commons actually managed to get its confidence together to hear women speak about the menopause, but it is now discussed on a normal basis on all sides. And I know that we're going to be hearing from Louise Newson later on, who's made the issue of menopause one of her specialties. So I think that when women are included in debate and in decision making, then you get better debates and decision making. However, I think that listening to Sajid Javid in his conference speech yesterday, he said health and social care begins at home, and indeed it does. Mostly it is women who are providing care and support for children, for health issues in relation to the elderly or those with disabilities. And that's why it is such a travesty that there is so little support for those women who are doing that work of social care and healthcare in the home as part of their family care. And I can only imagine the steam that must have been coming out of carers' ears when Sajid Javid, the Health Secretary, breezily refers to family care, but with no recognition that family carers, most of whom are women, need support, whether it's to get good access to and quick provision to primary care through their GP, whether it's not to be having to go from pillar to post through different departments in hospitals, whether it's seamless access to pharmacies, let alone social care. There is still a huge policy gap, an unrecognised area where there needs to be support for, as I say, mostly women doing important care and support in the home. When I was growing up, women really weren't expected to focus on their work. Their primary role was to be a wife and a mother, and if they did work, their work was likely to be part-time. If it was full-time, it was not seen as a career, and it was very much undervalued. But now women do work, but public policy has not caught up with this. And one of the things today that you might look at that Mumsnet has just produced is the issue about women who are working not being able to take time off to look after sick children. You cannot have a primary school age or a nursery school age child, a nursery age child, at home on their own if they're unwell. Somebody has to be with them. And yet, although there's sick pay and leave for a mother and a father, there's no sick pay or leave for when a child is sick. That is just a complete public policy vacuum. The Mumsnet survey showed that 88% of parents had taken time off work with a sick child. 40% took it as holiday or as annual leave. Others asked for it to be able to take off unpaid leave. And of course, it's low-income women who particularly are hit by having to take it as unpaid, whereas salaried women, although they have to ask as a favour of the management, at least they're able, when they are able to take time off, to take it off paid. We know there is a direct link between low income and poor healthcare, and it's women who are more likely to be low paid, insecure at work, have long hours, and also whilst doing the lion's share of work in the home. The universal credit cut will have an impact on women's health. The cut of £20 a week just yesterday will hit those on lowest incomes, most of those of whom are working. And when it comes to those who are caring for young children, that it is the overwhelming majority of universal credit claimants who will be hit by this £20 a week cut who are women. And when the national insurance increase comes along, again, that will have a disproportionate impact on low-paid women and will affect health, and also will affect those working in healthcare. And just as we have to look at women in relation to income in terms of their health, so too we have to look at ethnicity. Black and Asian women play an enormously important, huge role in delivering our healthcare. But the evidence is very much that there is an inequality in the experience of the service. As part of the Black Lives Matter focus last summer, the Joint Committee on Human Rights commissioned research and amongst the attitudes of Black people, asking whether they believe their healthcare, their health is equally protected compared to white people, and found that 60% of Black people felt that they did not believe their health was equally protected compared to white people. That's 60%. But when it came to Black women, who have a more experience of dealing with healthcare through their own health, but also through supporting their family members, 78% of Black women do not believe their health is equally protected compared to white people. And as yet, there is no plan in the NHS to acknowledge that and to address that. It should be benchmarked every year so that we can see that disparity narrowing. And it's not surprising that that view is there when you actually link that up with the recognition that Black women are 5 times more likely to die in childbirth than a white woman. But with that too, there is no target to end that. And we know that the NHS delivers by focusing on targets and measuring the progress towards that target year by year. It's not good enough simply to wring their hands about the disparity in maternal mortality of Black women. There needs to be targets. And to the extent that it's underlying health conditions, those should be addressed. And to the extent it's differential treatment, that should be acknowledged and addressed. So finally, I think it is very important that the NHS is held to account to drive forward improvements. And that is in Parliament, through us working as constituency MPs and the Health Select Committee and debates in Parliament, but it's also accountability to the courts. And that's why I very much support the work of Leigh and other lawyers who take forward the difficult work of clinical negligence. And there are many cases where clinical negligence cases have driven forward changes in policy. For example, in the 1980s and 90s, the change in the failing cervical cancer screening was driven by clinical negligence cases. So thank you to Leigh for your work that you do on this. And whether or not it's primary care or whether it's hospital care, whether it's mental health services, whether it's support for those with disabilities, or whether it's staff, patients or families, women's voices must be heard and must be equal in decision making. So I wish you well for the rest of your conference, which looks like a very exciting and important agenda. Thank you.